Let's begin the training with a scenario to see how familiar you are with heat stress symptoms and first aid methods. Imagining on a scorching summer day, a crew of hardworking construction workers toiled tirelessly under the blazing sun. The air felt thick and suffocating, offering no relief. At about 2 p.m. in the afternoon, you see one of your coworkers almost falls over when picking up some materials. You ask him if he's okay, and he aggressively says,
Yeah.
You go over to him and see that his face is red, but he's not even sweating. Hey, sit down for a second, you say, but he says, no, I am fine. Leave me alone. He tries to pick up the materials again, but he almost falls again. Take a minute to think about the following questions. Is this a heat stress emergency? What would you do in this situation? How to prevent this from happening again? If you are not sure or have no clue what action to take, don't worry. We will come back to this scenario at the end of this training, and with the knowledge you learn from this training, you will be more confident to deal with a situation like this and understand what to do to prevent this from happening. Workers who are exposed to extreme heat or work in hot environments may be at risk of heat stress. Heat stress can result in heat rashes, heat cramps, heat syncope, rhabdomyolysis, heat exhaustion, or heat stroke. Let's take a closer look at symptoms and first aid methods for each of them. Heat rash is a skin irritation caused by excessive sweating during hot, humid weather. Sweat glands become clogged and inflamed when sweat cannot evaporate. Symptoms of heat rash include: heat rash looks like a red cluster of pimples or small blisters. Sometimes it brings prickly or itchy sensation. It is more likely to occur on the neck and upper chest, in the groin, under the breasts, and in elbow creases. Workers experiencing heat rash should work in a cooler, less humid environment if possible. Keep the rash area dry. Apply powder to increase comfort. Don't use ointments and creams. Heat cramps usually affect workers who sweat a lot during strenuous activity. This sweating depletes the body's salt and moisture levels. A loss of body salt causes water to rush into the muscles, resulting in cramping or spasms. Heat cramps may also be a symptom of heat exhaustion. Muscle pain or spasms usually in the abdomen, arms, or legs. Workers with heat cramps should do the following. Drink water and have a snack or a drink that replaces carbohydrates and electrolytes every 15 to 20 minutes. Avoid salt tablets. Get medical help if the worker has heart problems, is on a low sodium diet, has cramps that do not subside within 1 hour. Heat syncope is a fainting episode or dizziness that usually occurs with prolonged standing or sudden rising from a sitting or lying position. Factors that may contribute to heat syncope include dehydration and lack of acclimatization. Symptoms of heat syncope include lightheadedness, dizziness, fainting. Workers with heat syncope should sit or lie down in a cool place when they begin to feel symptoms. Slowly drink water, clear juice, or a sports beverage. Rhabdomyolysis is a medical condition associated with heat stress and prolonged physical exertion. Rhabdomyolysis causes the rapid breakdown, rupture, and death of muscle. When muscle tissue dies, electrolytes and large proteins are released into the bloodstream. This can cause irregular heart rhythms, seizures, and damage to the kidneys. Symptoms of rhabdomyolysis include muscle cramps or pain, abnormally dark urine, like tea or cola-colored, weakness, exercise intolerance, asymptomatic. Workers with symptoms of rhabdomyolysis should stop activity, drink more liquids, water preferred, seek immediate care at the nearest medical facility. Ask to be checked for rhabdomyolysis. Heat exhaustion is the body's response to an excessive loss of water and salt, and blood flow to the brain is reduced as the body redirects blood to release heat from the skin. This results in less oxygen reaching the brain and therefore lightheadedness, headaches, and confusion. The body's temperature regulator is still functioning during this stage, trying to cool the body. Symptoms of heat exhaustion include headache, nausea, dizziness, weakness, irritability, thirst, heavy sweating, elevated body temperature, decreased urine output. Heat exhaustion first aid. Treat a worker suffering from heat exhaustion with the following. Take the worker to a clinic or emergency room for medical evaluation and treatment. Call 911 if medical care is unavailable. Have someone stay with the worker until help arrives. Remove the worker from the hot area and give liquids to drink. Remove unnecessary clothing, including shoes and socks. Cool the worker with cold compresses or have the worker wash their head, face, and neck with cold water. Encourage frequent sips of cool water. Heat stroke is the most serious heat-related disorder. It occurs when the body becomes unable to control its temperature, the body's temperature rises rapidly, the sweating mechanism fails, and the body is unable to cool down. When heat stroke occurs, the body temperature can rise to 106 degrees Fahrenheit or higher within 10 to 15 minutes. Heat stroke can cause death or permanent disability if emergency treatment is not given. Symptoms of heat stroke include confusion, altered mental status, slurred speech, loss of consciousness, coma, hot, dry skin or profuse sweating, seizures, very high body temperature, fatal if treatment delayed. Take the following steps to treat a worker with heat stroke. Call 911 and notify their supervisor. Move the sick worker to a cool shaded area. Cool the worker using methods such as soaking their clothes with water, spraying, sponging, or showering them with water, fanning their body.